Hey guys, I'm Dr. Forrest with Allen Spine and Sport, and I'm going to explain or describe what the McKenzie method of mechanical diagnosis and therapy is. It's a mouthful. We tend to abbreviate it as MDT, mechanical diagnosis and therapy. So essentially, this is a systematized diagnosis or classification is kind of the key term here, is a classification of spinal and extremity musculoskeletal conditions that patients come in with. And we use this classification system to put the patient into one of four buckets, which is very helpful for both the clinician and the patient to understand exactly what's going on and what movement at home is going to be the most beneficial or the quickest way to speed up their whatever condition they're dealing with. So for example, it's based on mechanics. So for example, like if your finger is held in this extension position for a little bit of time, it's not that painful, right? But if you push further and further and further or hold it for a couple hours, it's gonna get painful, right? So imagine this in every other joint in the body or muscular area, especially joint complexes. Depending on our repetitive movements, postures, work activities, previous injuries, athletics, we all put our bodies in these compromised positions that eventually mechanically develop into these painful conditions. So that's how we put the patient through, or that's why we put the patient through a mechanical exam, give them a mechanical classification in these one of four buckets: derangement, dysfunction, posture, or other. That's a topic for another day. The other is a few different classifications or sub-classifications that we will determine for the patient and give them recommendations on how to improve, both for treatment in the office and or if we need to refer them for someone else. So with that mechanical exam, we give the patient a specific classification, and then we use that classification to do different things in the office as far as like moving those specific joints into a specific direction. And then we evaluate the response to those specific movements, right? So for example, like if you were in this position for a long, long time, just at this finger, apply this to everywhere else in the body too: low back, neck, shoulder, hip, so on and so forth. Then maybe we give them repetitive flexion for a certain repetition or a certain amount of repetitions or a certain amount of sets, or we just hold flexion. And then we go through our initial evaluation to see if that made a change, whether it's strength, amount of pain, location of pain. And then we give that patient something to work on at home. And that's how we speed it up in between the visits to make them better. And then that also, throughout that process, we're teaching the patient what they can do at home if something kind of like happens again. Of course, if the wheels fall off, we need to do a re-exam, and that's why it's important to have a basis of a clinician to come to and ask questions, go through an exam, get a diagnosis, or a classification for that matter. And then we will quickly get you back on the way to healing. But the big thing about McKenzie is we promote self-efficacy, which means we teach the patient how to prevent this type of pain from coming back. And if it does come back at a lower level, they can a lot of times like take care of it at home with these movements that we teach them. And that's how we lessen the dependency on the healthcare system. And we can, like I said, promote self-efficacy so the patient has a tool belt for their own types of pain and dysfunction. So that's why McKenzie is so powerful, both on the clinician standpoint and for the patients. And it's something that I use every day as far as throughout my exams, throughout my treatments, and educating patients. So that's McKenzie in a nutshell. Please let me know if you have other questions. And again, I'm Dr. Forrest with Allen Spine and Sport.